Hello, everyone. Maria and
Gina.
Reflect and reset. Look at our cue cards now.
Yes, see, we have cue cards.
We are getting fancy here for you. So I want to say thank you so much for following us, right, Gina?
Yeah, we're getting a lot of followers. We noticed today we're getting a lot more followers.
I know. We're very excited because the more followers we have, the more of an impact we're making, we know. And as we said before, Reflect and Reset with Maria and Gina. We are so excited to always come to you on Wednesdays afternoons, and I know that we are becoming your favorite people.
And you know what? Also, let's add to that. You know, if there's anything, because we have our own programming, but anything that anybody wants to learn about, if you have any suggestions, just let us know. Like, email us or send us a little note within the live, and then we'll try to do a show on it.
That sounds great. Yeah. Sounds great, because we are definitely trying to get topics that are important to you and getting to educate you through Reflect and Reset with Maria and Gina. Yep. So, Gina, our guest.
We have a wonderful guest. And this is Dr. Kristine Cruz, who works at the Vein Center of Westchester.
Center for Vein Restoration.
Center for Vein Restoration.
And their community, they're community partners with us.
Yes, they are. So all our members are benefiting from even bigger discounts with the company. So first, we're going to ask you, Doctor, to explain a little bit about yourself.
So I work for Center for Vein Restoration. I'm a general surgeon. I have
general surgeon.
Okay. I have a special interest in dealing. I like minimally invasive procedures, and so here we are. Center for Vein offers a lot of minimally invasive procedures to treat venous disease.
How did you? So you became a physician first, right? And then you went into
general.
Yeah, we're going to be setting ourselves up with microphones so that it's going to be easier for our guests, because Gina and I are loud, so it's okay for us. But so I'm always interested in physicians, like when you choose a career as a surgeon, whatever the specialty is, like how did you decide that you wanted to do plastic surgery?
So I wanted to be a pediatrician at first, and when I got to med school, I did my pediatric rotation, and kids don't like you when you're a doctor, so I decided to change. My first class that I fell in love with was anatomy and physiology, and the professor was a surgeon. And
so you general surgery, and then but you specialized in veins?
In veins.
God, okay.
Wow. And so I know that we have a lot of patients that, especially in the Hispanic population, I know that, like Dr. Rosenzweig was saying, how because they're on their feet a lot, they have issues with their feet. Yeah. And I'm assuming because they're also on the work that, housekeeping or working in the restaurants, waiters, waitresses, that they have issues with the vein. I mean, not just the Latino community. We're just, we know because we have a large population that is Latino, but we have people that just are standing. They have more issues with veins, right?
And people that are only sitting.
All day. Okay.
With their legs crossed.
Is that right?
It doesn't either way. If you prolong sitting or prolong standing, you can have issues with your veins.
And it's painful because my husband owns a restaurant. He's on his feet all the time. And he has the veins in his ankles, and they actually hurt. His feet throb.
It's usually worse at night, so by the time he gets home, all the pressure that is on his venous system at the time, standing all day with venous insufficiency, the valves aren't working. So that means that pressure the blood flow, instead of going towards the heart, is staying towards more on the legs or extremity, and that increases the pressure, and then different things happen because of that increase in pressure.
And what would you do for that?
So first, we would always check with the ultrasound to see where exactly the problem is. You can go anywhere from non-invasive stuff like wearing stockings, and to if there are treatments that we do to decrease that pressure in areas of veins that aren't working. The veins that aren't working, we kind of take them out of the circulation so that it reroutes to other areas of veins that are working.
You cut them out?
No. Not necessarily.
Okay.
We close them either with radio. They have different modalities. So heat modality, those veins, the ones that you actually see ropey veins. Yeah. Then those we would We don't strip them like in the past. It's completely different.
They don't
It's
pull.
tiny.
They used to make little incisions
Yeah.
and pull them out.
Those are, we still do tiny little incisions along the length of the vein
Right.
that is visible or ropey like, big and ropey.
Wow, interesting.
And do insurance companies, they cover that procedure, right?
For patients that are symptomatic, who have the cramping, achy, itchy, different symptoms that go with vein disease and have venous problems, most insurance carriers cover it.
And if you suffer from these issues, I mean, you could actually lose your limb at one point. I mean, you could stop the blood flow. Isn't it true?
The veins are a little different because we have a lot of them, and they return blood to the heart. The arteries, if you have problems with the arteries, they take blood towards the extremities. So if you have problems with that, then you have a more of a chance of losing a limb. Veins, you can get ulcers though. So if you have venous stasis, you can get ulcers, and that very hard to treat. Takes a long time to heal.
What is an ulcer? What do you mean an ulcer?
So it's like a skin wound in the leg, usually in the lower part of the leg, the gator area it's called.
Okay.
So on the lower part, that's usually where they form, and it's just like a ulceration, like a wound that won't heal, and it will keep draining, and it looks like a hole essentially.
Is that an issue for diabetic patients?
If they have vein disease, yes. Diabetics can also have arterial disease, but yes, they can have a combination of both. And diabetics also have issues with neuropathy, so sometimes they don't feel when they get an injury. They get cuts easy, and they may not feel it, and they get infected easier, and it all.
That's what Dr. Rose is talking about, the neuropathy.
Yeah. So how about the famous spider veins that we all hate, especially women?
Yeah. Well, it's all, even those varicose, I mean, you're thinking it's cosmetic, but it goes so much deeper.
It does. And usually spider veins or the varicose veins could be the tip of the iceberg. That's why the ultrasound is really important, so we can check what's going on underneath. So you can have spider veins and maybe not have any issues on the veins underneath, but sometimes that signifies that there are issues with veins that you don't actually see. So if, I mean, they're common. They're like 70 to 80% of the population have some spider veins.
Are they like broken blood vessels? I mean, the
dilated blood vessels. So they're little vessels that we have, but they dilate. Mm-hmm. And they become more visible to the naked eye. They can happen anywhere.
I know. We get them
here.
Here.
The rosacea.
I by the way, I'm going to promote Formé.
Yeah,
we actually take care of that. I've been having the treatment on my nose here
because I'm noticing how good it looks.
It looks great.
Yeah.
Right?
Let's blow Maria up a little bit more.
Okay. We feed each other's ego, right, Gina?
Yeah, we do.
But seriously, I inherited that from my mom, I say, because my mom had it all around and then her legs. And I actually went 2 years of treatments for those spider veins in my legs where they were injecting inside. What is it that they inject?
So we usually use a sclerosant. There are FDA-approved sclerosants that basically you just kind of take that piece out of the circulation. So you close that vein.
And it works.
And it just disappears. It just kind of...
Yes.
You see it disappear right then and there.
Because what's the difference with the laser? Because we have the laser Genesis that does it.
Yes.
And it works on the...
So the laser works on the skin level, so it causes injury to that vessel, but from the outside. When we actually cannulate the vessel and cause injury from the inside to make it close.
So if somebody has multiple spider veins, you're doing multiple injections.
Yeah, I went through that.
Yeah.
I would go one treatment
in your legs?
In my legs, and I had a lot because can you inherit it?
Yes, you can.
So my mom gave me many beautiful things, but she gave me spider veins.
But you got beautiful legs, so I mean, you
can't complain.
But also you lift. I mean, can the spider veins be...
There's a lot of different causes. Smoking, trauma to any area. Lifting, I think there's a correlation for sure with it. So anything that increases
okay, don't worry.
No, it's good for you. Please lift.
Yeah.
It's very good for you.
Gina finds the excuse for working out. She always for not working out. So it's still beautiful. But we have to say that you started spinning.
Yes, I'm spinning with my sister, and I'm starting to. And I was even exercising at home by myself. I had my little computer with my weights.
With the 2-pound weight?
Yes, you have. I think they're 3 pounds.
3 pounds.
Exercise is good for everything, including the veins.
It's a start.
I'm just proud that you started.
Yeah.
You know, all it takes is really to start.
Yeah.
Like with this treatment, it is, I remember I made a conscious decision that I take care of my body.
Yeah.
I very much, you know, I'm looking at finding a way to always look my best. And for me, when I went through this treatment, I knew it was going to take time and money. But in my life, you know, I got to take care of me. You know, that's important. So I went through the treatment and all my veins disappear. I actually went back to your office, I think it was last year, and Dr. Fleischer said, you don't really need, there's not much there. Because there is maintenance that we have to do, right?
Sometimes, yes. It could take years though before you need
Yeah.
a touch-up.
It used to be my mom, when my mom was alive, my mom had very bad varicose. She had 6 children, so she had very bad veins. And but she had the scars because they were cutting
That was
and they
the
were
past,
pulling them out.
Yep.
And
It
she had
is
scars
ligation
all over
and
her
stripping.
legs.
It was a lot more invasive.
Yes.
If you need to have a surgery, then how long does it take to do the surgery, to remove the vein or whatever you do?
Yeah, so
Usually-
it depends. Like some people have it up and down their leg. The vein is long and tortuous, and so that may take more. So anywhere from half an hour to an hour. And we
That's
also
nothing.
we also check underneath again with the ultrasound. We know if there's a vein that we're not seeing that we need to treat at the same time. So we would do the radiofrequency with the phlebectomy. So that adds to the procedure hour and a half.
And is there downtime
Nope.
after?
You can go to work the same day. Maybe.
You can.
Yes.
Oh,
It
wow.
will
You
be
work out?
bandaged.
You work her out?
No, working out have to wait 3 to 5 days to do lifting. But walking is very important. That will prevent clots. So we want them to walk. They'll have a bandage. If we do a phlebectomy, they'll have the bandage on for longer.
Do you put them on like clotting medicine after you do
No.
it? You don't do nothing?
No. We do an ultrasound to follow up within a week to make sure that there is no DVT, that no complication happens.
And if there was a complication, what would the
We would
patient
treat it.
feel? What would the patient feel like if they knew that there was something going on?
Sometimes they don't know because it's not even enough that we wouldn't treat. We would just follow it. Sometimes it causes leg swelling, redness, painful. You shouldn't have any pain with this. It's only sore after the procedure. You know, it shouldn't get swollen. It shouldn't be painful, like extreme pain that nothing that Motrin or Tylenol wouldn't take care of.
Is age a factor on this?
As it being more common
Right.
as we age, yes. As we get older, the veins. Again, remember, especially in the legs, against gravity.
Right.
Everything's
No.
has to like
I knew Gina was gonna say something because she's always
I didn't
talking
say
about.
anything. I didn't say anything.
She's always talking about gravity. How gravity just, is
It
bringing
kinda
you
sets in, and
down.
what are you gonna do? You know, it's
But we see it as young as 18, 19. And then, you maybe see it a little bit more. If it's genetic, you'll see it younger.
How about weight? If you're overweight.
Overweight definitely
Oh,
increases the venous pressure, because it's on the abdomen and now it's harder to bring blood back up. So,
Wow.
so definitely obesity is a problem.
It's how about in men? Like
Men.
versus women versus men. Like what's the percentage that you would say that
It's
you're
still
seeing?
there. I mean, we see it more in women, but you still see it. It's about like if you say it affects 30 million Americans a year. Maybe 70% is female, and then 50-60% is male. So they're not with that. We see plenty of men with varicose veins, and it's not obviously pregnancy because in women it's the hormones and being pregnant, not just even in the beginning because our hormones dilate our vessels, and as they get
that's
bigger, they have
interesting.
that progesterone during pregnancy, even the early pregnancy.
so when you go into menopause, does it? I'm
Yeah.
serious. So
Well,
menopausal patients, does it?
does it get worse? No, that's not good. But just aging in general will
Yeah.
do it. So men is usually genetic. Jobs,
Yeah.
for long standing. Everything. The weight, obesity.
Now, is it the pain that is causing them to come and seek treatment?
Usually.
I mean, I know with women it's usually, it's the aesthetic look of it and how.
Not always. Not always. I'll tell you, I have some women that come in that have a lot of spider veins, but they don't complain about it. Their main complaint is, I can't stand my legs. They feel so heavy at the end of the day. I don't even want to move. I don't want to go do anything because they're so heavy, and I get cramps at night. I can't sleep. It wakes me up at night.
I get cramps at night. I'm serious. I'm serious, but I do get cramps at night. Like my feet cramp and the bottom of my legs cramp all the time. You know, maybe it's
So
something I should look
maybe you
into.
need to go for a consultation.
Oh, for a consultation.
You guys got a patient out of the Facebook Live. Look at this.
But gladly taking care of you.
And if we can nip and tuck a little
But
bit.
it can be associated with restless leg, cramping, and usually it's worse at night. And it'll be like, it's funny how quick that disappears as soon as you treat it. That's like.
So would you look by, I mean, if it's not visual for my legs, would it be by ultrasound? You would just see if there was something?
Yeah, by ultrasound.
Yeah, because I
So
get restless
you
legs
might
too.
not be able to see it, but it could be under.
You can have no spider veins and still have venous disease. If you have the symptoms, it's worth checking.
Yeah, I have restless leg like last night I was like, honey, my legs, I call them jumpy legs. You know, but they're
definitely come.
Yeah, I'm gonna come.
Because you don't necessarily have it, you don't have to see it on the outside.
Yeah, I'm
See,
gonna
those are the misperceptions that we have.
Yeah.
And because I honestly, I thought that you have to be able to see it in order to have issues
And
with
it's so uncomfortable because when you're sleeping, it's like if I move my foot in a certain position, all of a sudden my whole from here down and my foot cramps.
Oh,
and I'm like, oh my god,
I have it. That is so common.
Oh wow.
And you have to get up and walk around.
And it runs and I have to get up.
Yeah.
We have done a consultation on Facebook Live.
I'm going, but I'm going to go and I'm going to share with everybody what happens.
You can start trying to wear stockings and see if you see a difference. Compressions 20-30 up to the thigh during the day, and you wear heels. Heels are not the best for our calf pump.
I'll put sneakers.
No, I mean in terms of it doesn't allow the muscle to function as well. The calf
heels.
muscle.
So
so that make more.
I know. I just thought about it because I am running the New York City Marathon.
I think that's wonderful.
Thank you.
Yeah, so good.
But I wear heels, and now I'm having calves issue because I'm running and they're tightening up, and I realize that when I take off my heels, they're tight every night. So, but I cannot even imagine not having heels. I've lived in heels my whole life. What am I going to do? You and I need to.
I don't think you need to remove your heels. I think you need to check out your veins.
That, or also you wear like the wider the heel, the better for the calf muscle.
Yeah.
The pressure that it puts, the tinier, the thin
We're
heels.
We're going to go on Easy Stride. EasyStride.com for Maria's new heels.
Oh, my partner. Well, I'm going to take a moment to really promote our medical membership because, and not promote, really to tell you and tell you over and again the benefits that we have on our medical membership, and they're partners of ours. Everybody, there's so many people in our community that are working together to provide access to care for you. And you need to, if you don't have insurance, we always say you have to be a member. I mean, it's $29.95
It doesn't make sense not to.
It makes no sense. You get access to discount from your. Tell them the name of the
Center for Vein Restoration. We're located nationwide, but in New York we're in Scarsdale and White Plains, and in the Bronx.
Yeah, so
the Bronx too. Yeah.
You're able to get discount through the medical membership. So that's what we're working, and we love that this organization have decided to really partner with us and be giving back to the community, and it's awesome.
Yeah. Do you also accept all the products, Medicaid products as well?
Yes.
Okay, so that's beautiful. That's beautiful.
Yeah.
There's the nice thing is that there's options. And what Maria and I have realized, and even when we talk to somebody about the membership, is that if we don't have it here, we'll find it.
Right.
And then you guys, we're right in our back corner. And actually, my sister knows Dr. Fleischer, and so that's how I first met him.
Mm-hmm.
And then, but they're right in the back corner. And then we had somebody who needed it. We sought you guys out, and now you guys are part of the community partnership.
And we appreciate it.
And one of the things that we are pretty soon going to have is Promise to Aid.
Yes.
So the idea with Promise to Aid, let's say you see one of our members and you say, well, they need the surgery, and might cost $1,500, whatever it is, right? Because some of the procedures are still expensive. So Promise to Aid will be able to subsidize
That's great.
the care. We are very excited. This is the nonprofit organization that we've been trying to launch for a year.
About 8 months right now.
Yeah.
But it's, we're finally just at the end of getting our 501c3, so it's a tax deduction, tax exempt for everybody who donates. And we're going to ask, not only we're going to ask, go out to the community and ask, for funds to help the people that need it the most, but we're going to ask our members and our patients as well. What we're doing for you, give back a little bit, $1, $5, $10,
Yeah.
whatever they can afford, to get somebody out of pain and to help somebody, who's suffering. Because if you don't have, as we know, if you don't have a life-threatening disease, you're not getting Medicaid. So you're just going to live with the pain, and we just want to stop it. So we're,
Okay.
very, very exciting.
Yeah.
We have a lot of good things happening.
And let me ask you, so who is the one that's going to, like, the referrals that you get? Are you getting referrals from the primary care doctor? Is that normally, or the gynecologist, or the
Anybody.
patients come to you and just say, can they
Some
come?
some people just find us on their own, and some of them get it from the primary cares. It could be any provider.
It's almost like sometimes the primary care would be the one to say, I think you should look into this.
Mhm.
Because,
But
there are underlying
that's
issues.
a podiatrist,
Yes.
that's, OBGYN.
Yeah, so we're talking about underlying issues. We have these throbbing, besides the pain, there are issues that could happen.
Yes.
And, it's your whole inside, your mechanical system. It's like you just got to keep the plumbing going.
Yes.
Yeah.
And it's just, when one pipe stops, that everything seems to be out of whack.
Yes. And it puts you at a higher risk of having clots over the general population without venous disease. So.
Okay.
So we need
It's one
to,
of the
we got to make sure that we start, promoting
Yes.
health. This is our mission. We always say, our saying is, your health,
Our mission.
our mission,
Your
your
health.
health.
She'll
So-
learn it one day.
That's why I have
That's
my
why
partner.
she invited me.
Yes.
No, but I think that anybody who's out there who really is suffering from this, call us. If you don't remember the name for Dr. Cruz, just call us, and we'll guide you in the right direction and make sure that you get the best price possible. But and also, if you don't have insurance, if you're not sure if you can qualify for insurance, we have insurance companies right here that work in the company. So check it out. You might even be eligible. You don't even realize to have yourself fully covered, because we want you insured, but we're the alternative if you're not.
That's terrific.
Any advice for me as I train for the marathon when it comes to my
Veins?
legs?
There are compression garments during activities that
we
you
have them
can
inside.
use.
We have it?
We have them in the back. Yeah, we have all the compression garments.
I'm gonna go
Yeah.
get one. That would help when
I'm.
when I'm running.
Mhm.
Ooh.
That's a good point. And I should probably try it too. Maybe it'll stop my restless leg.
You
And
definitely should try it
and my
because
curve.
you will see a difference.
Is it just from the ankle to the knee, or
You can start with that knee, like around here.
okay? Yeah,
20-30 millimeters of mercury of compression.
20-30. All right. All right. I gotta see what we have. And if we don't have it, where do I get it? Can I get it from you? Or do I
Yes.
get it someplace else?
We'll get you.
Okay, good.
You guys,
We'll get
you
you
guys
everything.
sell that
We do sell the stockings.
They're
in
like-
the office.
They're like socks, right? Like compression socks.
They look like pantyhose.
But they're knee highs. But they go.
But we have the thigh highs, but they're different levels, and they're pantyhose ones. So they all go anywhere from the knee highs to thigh highs to pantyhose.
How long do you have to wear pantyhose, let's say, if you have the surgery usually?
We say about a week, so
About a
3 to 5 days
That's
after,
not
right
too
after
bad.
the procedure.
Yeah.
Okay.
That's not too bad, because, I mean, I don't like wearing pantyhose. Do
No. I'm very.
Yeah,
I don't like being constricted like that.
No.
In the wintertime, people
Yeah.
say, oh my
I
God.
like to wear my tights in the wintertime, with my boots.
Yeah.
But, otherwise, no.
No.
But if I'm going to wear this for my legs, right, for the rest of the leg, do I need to wear it every night until it goes away?
Not overnight. It's only during the day.
Only during the day.
Only during the day.
Oh, that'll be a look. That'll be a nice look of my dress.
I want to see that look.
And wait, I'm going to come in, I'm going to take a picture for everyone to see. And you wear it all day.
During the day, all day.
And you say,
take
why
it off
not
at
at
night.
night?
It's a graduated compression. It's meant to work against gravity. So
I
at
see,
night
so
you're
you're laying down, right? I see.
Does yoga help with?
If anything that moves your calf muscles, the muscles are what, the driving force that pushes blood out of the venous system up until the heart. So, yeah.
I started doing this yoga every morning. It's a 10-minute yoga. I'm adding so many things. I'm gonna have to wake up at 4 o'clock in the morning to do everything that I'm doing. But I realized that it's not, especially it's for the marathon. I realized that I have to figure out ways to stretch and without it to be boring in a way. So I found this through beachbody.com. They have this yoga.
That's a great way.
10 minutes in the morning, so you can do 10 minutes of yoga in the morning and 10 minutes before I go to sleep.
Oh, that probably puts you calms
Yeah,
down, right?
and I actually tried that with my daughter. I said, Natasha, join me. Let's do a yoga. And it relaxes you, and the exercises that they're doing, the moves, are, they say that it's supposed to induce, you to relax and be able to sleep better. So I'm adding that to my day because I have to stretch a lot for the marathon, which is, it's a little bit of a challenge, but challenges are just running 26.2 miles. It's a challenge, but it's exciting.
Yeah.
It's very exciting.
Yeah.
I'd like to do that one day.
Oh, well, you're young.
Maybe next year.
You're young. You're not, look,
You have
an
to
old lady
train.
like me could do
Not that
it.
young. But I have to train. I have, it takes a lot of training.
Yeah.
A lot of
I'm
training.
watching her.
Yeah.
Yeah, Gina is supporting
It's
me.
not one of my bucket lists.
It's
No.
not.
No, but it is my bucket list to be on the other end when she hits the
Yeah.
finish line with the champagne and the flowers
Yeah.
and champagne.
She's
So-
arranging the party at the end.
Yeah.
And,
Yeah, it'll be a good time.
Yeah.
It'll be a good time. And we'll be live. Don't worry, we'll be live with Maria crossing the finish line, and I will be live.
I love it.
So,
Anyway, so all good things come to an end.
Yes.
So our show is coming to an end, and we want to thank you so much, Dr.
Thank
Cruz,
you very much.
for joining us. And
why don't you give us?
We appreciate
Why don't you
it.
give the group your number so they can call you if they need you? Your telephone number. You know
if you
don't
don't know it, it's fine.
Okay.
Listen,
Call us. We'll tell you how to get it.
not just that. So what we're gonna do is this goes on our website under news. So
Yeah.
go into formaymedicalcenter.com, and you're going to be able to go under news, and you'll be able to find this show and be able to find the information. As a matter of fact, actually, they can go on Formé because under community partners, you're there.
listed, yes.
So thank you so much.
Thank you very
We look
much.
forward to having you. You're gonna come to the
Spanish,
Reflexiones con Maria on Monday. So
And I'm
one
gonna
of these
and I'll
Mondays.
just let you know what happens with my consultation.
Yes.
Yeah.
Anyway, thank you.
Yeah, it was great.
We're ready to go?
Yep.
Thank you so much.
Don't forget to
Remember to
like
like us. Bye bye.
See you next week.